resistance to ampicillin. Amoxicillin, 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 xylin, clavanet, clavolnet, or clarithromycin is more effective. Now let's study about prophylaxis. Okay. A purified type B capsular polysaccharide vaccine is used in children of 18 to 24 months. Vaccine is administered in 2 doses as an interval of 2 months. HIV PRP vaccine is in which type B capsular polysaccharide is covalently coupled to proteins such as diphtheria toxoid, tetanus toxoid, and N meningitidis outer membrane protein. Such Hev PRP are available for use in young children. Rifampicillin is given for 4 days to prevent infection in contacts and also to eradicate carrier state. Now, let's know about other Hemophilus. Hemophilus influenza biotype Aegyptius, Coach-Weeks bacillus H. aegyptius. It was first observed by Koch in 1883 in cases of acute conjunctivitis in Egypt and was first cultured by Weeks in 1887 in New York. It causes a highly contagious form of conjunctivitis, pink eye. It is worldwide in distribution. The organism, formerly known as H. aegyptius, is now thought to be a biotype of H. influenza. It has features similar to that of H. influenza biotype 3. It also causes Brazilian purpuric fever, which is characterized by conjunctivitis, high fever, vomiting, purpura, petechia, septicemia, and shock. It responds to combination of ampicillin and chloramphenicol. Now let's study about Hemophilus ducreyi. H. ducreyi was first demonstrated in 1890 by Ducrey in chancroid lesions, a venereal disease transmitted by direct contact. Now let's study about the morphology. H. ducreyi is a short gram-negative coccobacillus 1 to 1.5 micrometer into 0.6 micrometer in size. They have a tendency to occur in groups or in parallel chains. They frequently take bipolar staining. The microscopic findings has been described as resembling a school office appearance. Let's study about culture. It does not grow in ordinary laboratory media but has complex growth requirements. It requires X factor but not V factor for its growth. Primary isolation is difficult. It can be grown on rabbit blood agar, fresh clotted rabbit blood, or chocolate agar enriched with 1% isobutylix and containing vancomycin as a selective agent. It requires 10% carbon dioxide and high humidity for primary isolation. Optimum temperature for growth is 35 degrees centigrade for 2 to 8 days. It may also be grown on chorioallantoic membrane of the chick embryo. After 24 hours of incubation, the colonies of H. ducreyi are small, gray, small pinpoint to 0.5 mm in diameter, translucent, non-mucoid. After 48 to 72 hours, the colonies are 1 to 2 mm in diameter and become semi-opaque. Now let's study about biochemical reactions. It is biochemically inert except positive nitrate reduction test. Now let's study about pathogenesis. H. ducreyi causes chancroid or soft sore, a highly contagious sexually transmitted disease characterized by tender, non-indurated, irregular ulcers on the genitalia. The infection remains localized, spreading only to the inguinal lymph node, which are enlarged and painful. Sometimes it leads to inguinal abscess called bubo. There is no immunity following infection, but a hypersensitivity develops. Con- Chancroid is also known as soft chancre. Now let's study about the laboratory diagnosis. First is specimen. Scrapage of the ulcer or aspirated material from bubo. Now let's study about direct microscopy. Gram staining of the smear shows typical gram negative coccobacilli. Now let's study about the culture. Specimens are inoculated on chocolate agar with 1% isobutylase. Vancomycin is added to make the medium selective. Incubate the medium at 35 degrees centigrade in a humid atmosphere and 10% carbon dioxide for 2 to 8 days and look for characteristic colonies. Colony morphology and staining. Let's know about the colony morphology and staining. Colonies are gram smear, translucent and non-mucoid. Gram staining shows gram negative coccobacilli. Now let's know about the agglutination. H. ducreyi is antigenically homogeneous and cultures are identified by agglutination with the antiserum. Now let's study about the treatment. Cotrimoxazole or erythromycin is the drug of choice, but resistant strains occur. Newer drugs including cefotaxime and ciprofloxacin have been shown to be effective. Now let's study about Hemophilus parainfluenza. It differs from H. influenza in requiring the V factor only and not the X factor. It is a commensal in the upper respiratory tract and may occasionally cause acute pharyngitis, subacute bacterial endocarditis and urethritis. Now let's study about Hemophilus hemolyticus. It occurs as a commensal in the upper respiratory tract. It requires both X and V factors. It produces a zone of beta hemolysis around its colonies on blood agar and may be mistaken for hemolytic streptococci. It is non-pathogenic. Similar strains that require only the V factor and not the X factor are termed H. parahemolyticus. Now, let's study about Hemophilus arthrophilus. It requires the X factor but not the V factor for primary isolation. Its name refers to its high carbon dioxide requirement for optimal growth. It may cause bacterial endocarditis, brain abscess, pneumonia, sinusitis, and abscess. Similar strains require the V factor but not the X factor have been named H. paraprophilus. Now let's study about Hasek group bacteria. Hasek refers to a group of fastidious bacteria normally resident in the mouth but can sometimes cause severe infections such as endocarditis. This group contains Hemophilus species, that is parainfluenza, Aphrophilus, Paraphrophilus, Actinobacillus, Actinomycetimycans, Cardiobacterium hominis, Echinella corrodans, and Kingella kingi. Blood cultures from patients with these bacteria take 7 to 30 days to become positive. As drug resistant is common, antibiotic sensitivity tests are essential. Now let's study about Gardnerella vaginalis, Cornybacterium vaginalis and Hemophilus vaginalis. As this bacillus does not require X and V factors, it has been placed in the new genus Gardnerella. It has been isolated from the normal vagina and male urethra. Now let's study about the morphology. These are small 1 to 2 micrometer and 0.3 to 0.6 micrometer in size. Gram negative, non-sporing, non-capsulated, non-motile, pleomorphic bacilli. They are sometimes gram variable. Now let's study about the culture. The organisms grow on enriched media such as blood agar or chocolate agar. They are facultative anaerobes and grow well at an optimum temperature of 37 degrees centigrade and optimum pH 6.8. The growth is enhanced by 5% carbon dioxide and humidity. The inoculated medium is incubated for 48 hours. Small beta hemolytic colonies develop on human or rabbit blood agar. Now, let's study about the biochemical reactions. It is catalase, oxidase, indole, and urease negative. Now, let's study about the pathogenesis. G. vaginalis causes non-specific vaginitis and cervicitis, usually in association with anaerobic bacteria. In vaginosis, the vaginal discharge emits a fishy odor. Gram staining shows clue cells, which are vaginal epithelial cells covered with many tiny gram variable rods, the so-called clue cells of Gardner and Dick. Now let's study about the clinical features. They are foul smelling, vaginal discharge with raised pH. The odor is due to amines and that gets intensified by mixing with a drop of KOH and is named amine test. Now let's study about the diagnosis. Animal gram staining of vaginal discharge smear shows clue cells. G. vaginalis can be isolated on blood agar. Now let's study about the treatment. Metronidazole is generally effective. Finally finished. Any questions regarding this, you can ask me in the comment box and subscribe my channel to know more updates. Thank you.